Hi everyone and welcome to a new episode of Next. Today, I'm thrilled to have Quitterie Marque with us. Quitterie is currently Senior Vice President APAC at Koa Health, and she's a true visionary leader at the intersection of healthcare innovation and technology transformation. With her extensive experience across Asia-Pacific markets and her deep expertise in digital health strategies, she's been at the forefront of reimagining how we approach wellness, prevention, and patient care. Today, we'll be driving into one of the most critical shifts happening in healthcare, the move from simply living longer to living better. Quitterie, welcome to Next. And to start with, could you share a bit about your journey from your early career to Koa Health?
Thank you, David. And first, thank you very much for inviting me. I'm very excited and delighted to spend this time with you and discuss about those topics, which I'm absolutely passionate about. I hope you'll hear that. So my journey, originally I have a math and IT background with graduate degrees in France and the US. And so I started my career in tech as a good engineer, but quickly I wanted more meaning. So I moved to healthcare now 16 years ago. And I've worked both in startup and multinationals, one startup in neuroscience, another startup in mental health, and 10 years with international SOS. So I had various roles in operations, products. And my last role, I actually set up the data analytics department for the group. So I had the pleasure of, and we'll discuss about that, I guess, on the tech and seeing this from inside out, digitalizing for 1,000 clinics in remote areas. And I've always had a taste for learning and discovering new cultures. So my career and life, I've been living and working on 3 continents. And as you were mentioning, including 15 years in Asia. So very happy to join you today and discussing with you, David.
Thank you, and actually great journey and very international. So Quitterie, I'd like to talk about lifespan and healthspan because this is something you're really keen about. There's a lot of buzz around longevity today, but you emphasize a crucial distinction, healthspan versus lifespan. So beyond the individual level, how does this shift fundamentally change the economic equation for companies, insurers, and even government?
Yes, indeed. I think it's really booming. I'm sure people have heard about, the Brian Johnson approach, but also more scientifically proven, Peter Attia, Mark Hyman. So there's plenty of those coming on the market. There's also all those longevity clinics sprouting everywhere, and even the gyms, the hotels, they go into that field. And I believe and I hope that's a more profound trend and shift than just the wellness sector. And I think this is happening because we are at a crossroad of different trends which are making this happen. So, of course, there's the inadequate healthcare systems, which are effectively sick care models versus more healthcare models. We have the technological advancements, particularly around data, which are booming. And as you're mentioning, there's people living longer. But the problem is today people are living longer, but they're living more years spent in poor health. And that's the distinction that is mentioning about health span versus lifespan. So lifespan is how many years you're going to live, and health span is how many years in good health you're going to have. And what's the point? Of course, that's a more ethical or philosophical debate, but what's the point of living longer? It's if it's to live, in poor health. And generally speaking, there are 4 pillars that we describe in health span or longevity. It's nutrition, physical activity, mental health, and sleep. And this concept of a health span you're mentioning for companies, insurers, and government, I think it's really a concept that's going to affect throughout, right? So for companies, if you have an employee who's not in optimal health, then you'd have optimal performance. And I think this is becoming popular, what we're seeing, especially already at C-levels. We see those examples of the famous CEO, you have Novartis, many companies where those C-level, they're super fit, right? They really take extreme good care of the health from across those 4 items. And it's really about, being the best version of yourself in general. And of course, that will have ripple effect at work, right? Also, there's, debate of we have people living longer and then going to work longer. And the issue is how to deal with the senior if they are not in good health, right? They can't be best performers if they're not in good health. So I think companies clearly are impacted For insurers, I think they also have a big role to play. They have a vested, if one person is interested for you to be in good health as long as possible, of course, that's your insurer. So I think now we can see that they are crafting more and more innovative approaches. They're partnering with diagnostics, they are financing more checkups, etc. And also they're doing all those, platforms and lifestyle apps to incentivize you to stay healthier and do the lifestyle changes that are going to be better for you in the long run. Last point around, you were asking about governments. I think to me, this Healthspan revolution is a systemic change. It will be pervasive, right? It's companies, insurers, but it's everyone. And it's not only, and I think that's an important point, it's not only the healthcare system. It's also the workplace, like we discussed, but also schools, communities, and it's how you enable policy change to support the right incentive for everyone.
Thank you. And you're throwing lots of concepts that are extremely interesting. And I think we could discuss and debate for hours. I just point out a few. So you talk about behavioral changes. You also talk about the importance of prevention and how tech can help that. We'll come to that in a few minutes. But what I hear is, at the end of the day, there's a lot around the patient. So the patient at the heart of the discussion. How can we make sure that, or before being a patient, humans actually stay healthy longer? And that leads me to a notion, the forgotten patient. It's often said that healthcare is one of the few sectors actually where the customer is not at the center. And coming from the FMCG and retail, actually in those industries, we place the customer at the heart. So you'd never sell the same cream to everyone. So what would it cost us not to put patient back at the heart of the system? And conversely, what gains can we expect if we truly adopt a consumer-centric approach in this sector?
Yeah, it's spot on. I think healthcare, like you mentioned, is probably one of the industry that's very late in this patient or user-centric approach. You're mentioning we're not wearing the same cream, same thing. We would not wear the same clothes, the same shoes, but for most of the pathologies, we would go through a similar clinical protocol and have the same dosage. So of course, not completely true. When we look at oncology, there's more advanced personalization, number of things are adjusted, etc. But overall, if you compare industry to industry, it's late, right? And it's specifically in the what we call the care navigation right now. And I think we've all gone through that, or someone close to us has gone through that. So we have to navigate the system. The system is not a patient center, right? It's different players. We're discussing about insurance, and then the hospitals, and then the workplace, etc. And it's we're talking about FMCG. What if we had user experience of Starbucks in the healthcare model? This is today really far from that. And I think, or just discussing about technology, I think Gen AI could be very useful to deal and to help in putting together all those actors and have a more streamlined patient flow. And if we go a bit one step, I've had this a bit hard discussion with a few hospital and especially in the public space, right? Of course, there are differences between countries, between systems, but the reality is for them today, the first priority tend to be the medical professionals because they are very hard to recruit. They're burnout. I mean, the system is overworked, right? And then the second usually would be the admin. So whatever, insurers or public systems, so they're getting paid and the hospitals run. And then third comes the patient. And of course, that's not a critique. And for them right now, most of the time, is the best way for them to provide the best care because if there's no more doctors or they don't get paid in the hospital close and they won't do it, they won't do anything for their patients. So the reality is that strictly speaking, the patient is unfortunately not the client in most of the case. So I think that's why also systemically we get into that situation because in a number of countries, the patient is not the person who's paying. That's a bit to go at the core. I think that's how, of course, this has deviated and the industry has not been evolving as fast as other industries like FMCG or others, which you're mentioning. For me, there's massive benefits of being more patient-centric, impact on adherence, on the outcome, on satisfaction. There's also less errors and falls through the cracks. So there would be huge opportunities in helping or at least bringing it to another level from what it is today.
It's actually very interesting. And again, I think you're touching a dilemma that is actually something that we all face. And it's that tension between short-term and longer-term sustainable growth. And how do you anchor your growth or your development in the longer term, in a sustainable way, whilst having, to your point, you need to pay, you need to run the hospitals, because otherwise you can have all the best series in the world. If we cannot just welcome people in hospitals, then what's the point? You mentioned technology and Gen AI, but it starts with data. If you don't have the right data at the heart, you can have the best technology, it won't reach, the level you expect to. So this consumer-centric approach or logic naturally leads us to personalization, because basically what you're saying is like personalize the health and the way we treat patients. So you talk about the potential of combining different elements. You speak about DNA, microbiome, wearables, biomarkers. So where do we actually stand today? And what are the barriers, for instance, technical, ethical, regulatory, that are still holding us back towards this personalization revolution?
Yeah, this is a topic which I love discussing. So I think technically we are getting there, and there are several ventures, platforms in various regions which are opening up and being launched. So we have advanced testing capabilities, DNA, you mentioned also epigenetics, full body MRI, super comprehensive lab test. And what's super interesting, and we're talking about data, with the technical advancement, now we have this ability to cross the data source,
Yeah.
to deeply analyze, derive insights, and having personal insight. And this is, extremely powerful intelligence and personalization potential. So I think technically, we're getting there. It's few barriers now which stand in the way. For mentioning ethical and regulatory, I think there are very large cultural differences and regional differences. So I've been living, as I was mentioning, 15 years in Asia. DNA, microbiome, etc. Testing is mainstream. And in other part of the world, for example, Europe, it's heavily regulated. And, DNA testing can be, in some countries, is illegal outside of, a prescription with a targeted use, right? But you're basically looking out for a specific variability in the genome, associated with a disease, right? And so there's huge discrepancies. And in data also, if you look at the appetite, let's say, to play and to collect and to analyze data, it's very different if you compare again China or Europe, right? And probably the US is somewhere in the middle on that spectrum. So clearly, this is where I see huge cultural and regional differences. But yeah, Asia probably being not the most advanced, then more the US and Americas, and then Europe last on that perspective. So that's where we stand on this, and maybe adding I think one barrier also which is there right now, it's the barrier of the cost. We are mentioning about it needs to be sustainable, etc.
Yeah.
That's a very valid point. Today, most of those treatments, and checkups, they are still very expensive, and I see it's like technology. Right now, you have only the early adopters can afford it. And it used to be, a full body MRI. It used to be like, let's say, $10,000. And right now, Ezra, which has been acquired by Function Health, you have a full body MRI for $499. So that's becoming very accessible. And they also have very comprehensive lab tests, Function Health, at the same price. So what we're seeing now is, I think this shift, it was not also accessible because it was expensive. And right now, the systems are very bad at financing prevention. Unfortunately, we've been able to set up systems which are good at acute care, at sickness, but not well at the prevention. So there's this open debate of who's going to pay, right? And this cost to me remains a real barrier. But I see this changing. I see it progressively democratizing. I see those development becoming more and more accessible until, hopefully in some midterm, they are part of universal coverage. Tech, I think, has a very interesting role to play there to lower the costs and also driving the insights and making this accessible.
Interesting. So basically, if I listen to you, what I hear is that the future, I wouldn't say is bright, but there's some positivity ahead. If we look back in the rear mirror, we've seen different healthcare initiatives, massive investments that failed. Today, listening to you, the difference is that mentality is evolving, accessibility is becoming easier, better? And what about cross-fertilization, ethical mentality changes? You mentioned Asia, the US, and the gap between Europe. Are these people at government level or within the industry talking with each other and learning from each other? And do you think we can learn from the more advanced?
So I think governments in general, unfortunately, they tend unfortunately to look more inwards than outwards. But this being said, I was living in Singapore for a very long time, and Singapore has this very open-minded model where they screen through the whole world. They look for each problematic. They look at the whole of the screen, and then they choose the best, which can be adapted to their countries. And me personally, having gone to different regions, I've tried to cross-pollinate, right? So recently we've been presenting what the Singapore government has been pushing in terms of mental health in France, right, which also has declared mental health national cause in France. So I guess it's not the natural tendencies, but more and more, and it's for all of us to encourage this and to support it, right? Because I think there's definitely always benefits in sharing and learning from what the others have been doing. And to the second part of the question, at some point, as I mentioned, we have models which are not optimal, which are not necessarily financially viable, etc. If other regions are developing models, and we discussed also where the innovation come from, right? Developing models that work, at some point, I think there's going to be a shift whereby whatever is workable and successful is going to take over naturally.
All right. So I'd like to touch a little bit more on 2 points. So you mentioned earlier on as well the innovation. You just touched on innovation as well, and how Singapore is doing. And you also mentioned mental health, which is a big issue. And when we first met, you shared with me a figure that really struck me. You mentioned that 71% of mental health innovation in Southeast Asia happens outside traditional medical settings like school, businesses, communities. So my real question here is, what structural advantages do these outsiders have that the healthcare industry is lacking? And what creates those conditions for real innovation outside, whilst the traditional system seems stuck?
So the number you're referring is part of a survey from the Mental Health Innovation Network. And I think it's very telling, right? Those 71% outside of the traditional healthcare system.
It's crazy.
I think when we look at just taking a bit of perspective, I think we're saying, there's some issues structurally in the healthcare system. And I think mental health as a subgroup within that industry has been even more problematic, right? And so we need to acknowledge there's a huge gap in mental health overall, right? It's been underfunded, underserved, underreported, under a lot of things, right? And 2% of the health budget only goes to mental health, right? And 2/3 of that overall goes to psychiatric hospitals, right? To acute care. So there's a lot of gaps in mental health, even more than within the broader health umbrella. There's also stigma, discrimination. We usually say 75 to 95% treatment gap. So I think it's the issue right now. It's multifactorial. And of course, that's making it complex, right? So there's inertia, because those are, big system, traditional, conservative. As we were discussing earlier, they're overworked, right? They just have no more capacity. Very interesting also is to know the culture. And if we compare with FMCG or other industries, it's a very risk-averse culture for good reasons, because you're dealing with human lives. It's not like, okay, I'll go agile and I try it out and the person dies, right? You you have to be careful in the approach you're taking. And as we were saying also, there's, these systemic issues, they can't afford basically to invest in change or prevention, right? And so what we're seeing, I think, is when the systems are not adequate, solutions emerge elsewhere. That's human nature. And I think it's very likely that other models will develop on the side and kind of show the way, right? And I think also it's a great thing, because it can help, to rethink the models. So we're discussing about schools. So for example, we're discussing about mental health in Singapore. They've launched a whole program to teach resilience and mental health at schools, right? And it's not only the healthcare system, right? It's how you deal with that early. Communities where you can have a proximity care, which is of course, cost efficient, but also way less stigmatizing. And we see very high level of efficacy at the workplace, insurers, etc. So I think things emerge because we have those problems are not going to disappear because the system can't, manage them. So things are going to get around that. And in mental health, we talk a lot around the step care model, which is basically not just basic prevention or going to psychiatric care or acute care. It's broader choices, more fluid, more patient-centered. You look at the readiness of the patients, not only the severity of the symptom. And there's also the, nurse-led models, which are like the bird dog model, which are a lot of potential. That's also, allopathic versus traditional nutrition, physical, etc. So I think that's why, we're seeing all this, those innovation coming from those many places. And I think this is actually very rich. And there also tech will be a great enabler, I believe.
That's very interesting because just end up with tech, obviously. But when you were describing what's happening, for instance, in Singapore, what I hear is the power of the community, proximity, the sense of people, let's say human, caring, listening and being attentive, paying attention. And I'm a big fan of technology like you are. Otherwise, I wouldn't do this podcast and everything I do in my career. But I also believe, like many, that technology alone is not enough. And yes, we can leverage technology, but human must be at the heart, at the center. And that leads me to this notion of hybrid healthcare approach, where community, human, and technology can really make the best out of what is existing out there. And I know you also advocate for a hybrid approach rather than going fully digital. But in this specific context, what does hybrid actually mean in practice? And how do you preserve the therapeutic alliance whilst maximizing technology's contribution?
Yeah, we could also debate this, but I'm a firm believer that the future of healthcare, at least short term, is hybrid. And I don't think doctors will be replaced by AI, but I deeply believe that doctors who don't leverage hospitals who don't leverage AI will be replaced by doctors or hospitals who will. And in practice, there's massive opportunities for that. The thing is, I'm a tech by background, so I know this is bias. You start to focus on the tech.
Yeah.
But the reality, which is true in many industries, but even more so in healthcare, is to start, with the why. Why are we doing it? And what's the right use cases? And the second mantra I have is around simple. And so I think that's also one of the reasons why we have so many failures in tech in the healthcare industry, right? Because we start with things complicated, and as we discussed, it's already a complex ecosystem with many players, with plenty of things. And then if you don't start simple, those things just they just fail in implementation, right? And you can have the best tool, but if it's not used, it's useless. And so concrete use case which I see is I think digital has a multiplier effect, right? And scaling effect. Use cases could be around monitoring. Especially, I think it's very powerful to see longitudinal data sets. Usually in the healthcare system, you have a snapshot, but having the full view is very interesting. For example, at Koa, we have a algorithm that basically comes on EHR, so medical notes, and are able to detect crisis 4 weeks in advance. That's very powerful. So once you detect, basically you're able to spot, to flag a population at risk, and that would send an alert to the treating physician. And then the physician, the clinician, can then decide, okay, what do I do? Is it really a risk? Do I confirm the risk? Do I reach out? Do I do a specific program, etc.? And so it's this combination of the two, right? We discussed earlier also about diagnostics and evaluations. It's now we know that the reading of all those MRIs and images, tech is extremely powerful. But again, you want to have like a doctor there also to accompany and explain to the patient and then go through that chain and decide on the protocol, right? So it's the combination of both. Same, I think, with training on continuous medical education or supervision. That's also very powerful. And again, it's hybrid. We talked about communities, but digital communities and digital models are also very powerful. All of this is not actually clinical work, right? All the use cases I've described are more hybrid in the overall care pathways and journey. And now if we go to therapeutics themselves, when we're looking at digital therapeutics, usually they are about augmenting the clinicians. So at Koa, we have digital CBT programs, for example. And so basically the idea is it's still supervised by a clinician, and you have touch points. So you still have this human connection, this trust, the clinician on board the patient. Then there's many things along the way that the patient can do themselves. So it's more productivity for the clinician, whatever, they're, for example, repeating themselves, explaining what depression is or how, what CBT is, etc. Digital is very interesting. And also, instead of waiting in between sessions, you have like behavioral experiments or cognitive reframing, things which you can do, every day. So it's clinician productivity, but it's also patient empowerment. It's better outcome and satisfactions, right? I mean, I could go on forever, but yeah, there's plenty of use cases. But we need to go back to why we're doing it. What's the outcome, and simple, right? How does this integrate into an easy, impactful, basically flow?
Thank you very much. And that conclusion is very valid for many industries. Why are we doing things and doing meaningful technology? That's also something I preach for, not just for the sake of. What I hear from you is very interesting. It's also the fact that you're treating or visioning things in a holistic way. It's not just treating; it's also preventing before having to heal. Basically, it's about behavior, changing behaviors. Do you have maybe just a few concrete examples how tech can change or participate in changing behaviors at the patient level in order to ensure that we keep in good health?
Yeah, I think that's also an area which is fascinating and untapped, I think, until now. So the first aspect is around habits formation, right? And we're discussing before around the New Year resolution, which never happened, right? Or not never, but rarely happen. And the idea is not because the objective is not the right one. The problem is around thinking, once you've defined your objective, you need to think of the process and system that you have to put in place for lifestyle change, right? So if you decide to eat healthy, okay, great. Now you need to empty your shelf of all this junk food. You need to organize a weekly delivery of organic fruits and veggies. You need to make sure that you meet the friends that are going to support you in that lifestyle, or at least not try to push you to eat that pizza. So it's really, yeah, this habit formation. And there, I think tech is very powerful. We use what we call COMPI model. So there's a number of framework that are available and which are basically structuring, how to help and to nudge for these lifestyle changes. What's the capacity to perform that? What's the opportunity and what's the motivation around that, right? And so basically in the patient flow, we've really used and leveraged those framework basically to make this happen. And that goes also to what we were discussing earlier about personalization, right? Profiling. For example, we have algorithms that are able to basically infer personality type or profiling of the person. And once you have this info, you can personalize the intervention. You can personalize how you guide, how you nudge through those changes. We have also algorithm basically, which can tell you, when is the best time to digitally engage with you, what kind of message. We've heard a lot about the big five or the ocean model, which is basically been used, unfortunately. There's been a bit of bad press around Cambridge Analytica, but it remains a very powerful tool, which if used for good uses can be extremely powerful, so you can personalize the message to make it more impactful, basically. And also, we were discussing about diagnostics earlier. I find that all these diagnostic and tech insights can be very powerful. Basically, we see in human behavior that you have opportunities to change, right? If you tell something, you're going to be receptive differently at different, time of the day, time of your life, etc. And what we see is, we see that people are more willing to change. For example, when you get pregnant, when you just had a diagnostics, right? Or I don't know, one of your parents got diagnosed with Alzheimer, and you want to do the lifestyle because you have the gene and basically to a higher risk. And so you don't want to declare the disease, right? Having, those events we're discussing about, microbiome, DNA, etc. Having those things. And once you have the diagnostic, that can be very powerful to trigger the change if you leverage it correctly.
Well, very interesting, and I think there's definitely yes lots to do in this area, as you said. Before we close, and it's also on that topic of prevention, which is really key. I'd like to tap into one last big topic, which can be called as kind of a silent epidemic. 75% of mental health disorders emerge before the age of 24 years old. Yet, only 0.1% of health development is targeted at youth population. So, when we talk about facing this silent epidemic, what innovative solution, even non-medical ones, as you described, could have a rapid impact here?
Yeah. So indeed, the rates and the numbers we're seeing, it's a youth epidemic. It's very alarming, and we need to acknowledge that. And this is being done, but this is, I would say, relatively recent. And today there's massive needs both for children, adolescent, and youth in general. So we have this anxious generation. So it's multifactorial. We know, without going details of the cause, right? We have social medias and digital, which also can have, bad influences. We have, uncertainty, global environment. We have the nutrition and food, right? We have also impact on poor nutrition and poor poor health habits in general. So the reality is that that's been declining. And the other thing we need to realize is, it's one health. There's this concept of one health. This is coming. There's no physical health without mental health, right? And no mental health without physical health. So, people with severe mental health issues die 10 to 20 years earlier, right? They're very well documented comorbidities between mental health issues and physical health issues. And we're talking about, integrative medicine. And that's something which definitely has potential. So now this is, becoming a priority for WHO, national cause in many countries, so we mentioned Singapore and a number of countries are getting there. And I think it's going to be a focus specifically for children, teens, and youth in the coming years. To your questions of solutions, clearly, of course, I'm biased a bit, but it's not over, more medications, right? Because we know right now that we are over medicating already. With 23%, on average in the US receive psychological treatment versus 90% receive medication. And the rest of the world, that's probably even worse. So in terms of what I've seen as innovation, so the Singapore model is quite interesting. They have done a task force for the 3 to 11 years old, and how they do that, because that's very young, right? They go through the parents. Also, as I was mentioning, through schools. Now, resilience or mental health is taught at school from primary school. So from, kindergarten, childcare, right? So super early. They have launched also Let's Talk initiative for the age 17 to 25, which is showing very interesting results. So basically, they're also leveraging peer support. In that space, a teenager love to speak with somebody who has gone through that, who's the same age, who understands, what the pressure, what they're going through. So that has been very effective. There's also Mindline, which basically is a platform which is one single entry door, because we were discussing about fragmentation. And so for kids or young, it's even, more difficult for them to navigate the system, and not even to mention the stigma and the cost and all stuff. And so they've done one front door for all the mental health services. And so you can get to this, let's talk to these communities, but also you can get the help and the chat and also, psychoeducation and all that stuff. So having, simplifying the journey is also a great innovation. And more generally, they are basically currently training all the pediatrician, and actually for the same benefits, also GPs, to have some knowledge around mental health. So also this can be, because we've had this tendency in mental health to park it. It's not well integrated into the overall healthcare system. And integrating it and having this, again, one health approach is something which to me is also has a lot of potential, and is something which is very interesting innovation to look at.
I love this notion of one health approach. Actually, it seems simple, but it's so true. And to your point, one entry door, and then to treat, looking at the holistic aspect, that might be indeed one of the solutions. Because again, if I place myself as a patient, it's easy. It's accessible. You don't need to look at, okay, which door should I open? Where should I go? There's one door. And then we look at health in a holistic way. I think that's extremely powerful. Thank you for sharing this. We're getting to the end of this conversation. If you had one message, Quitterie, for decision makers, CEOs, you mentioned, public officials, insurers, and head of, hospitals, to truly shift them towards a health plan mindset, what would it be?
So with my Asian touch, I love this Confucius quote, which says, A healthy man wants 1,000 things, but the sick man only wants one, and it's health. So to start to consider health as wealth and to start today. If you don't wait 50 years old or 60 years old to start building your financial wealth, right? You start early to plan, to save. Why are we not doing the same thing for our health? For most of us, actually, right? And not having this sick model, but really going to this health model, now waiting to cross that line, which is okay. Now we're sick, but between the optimum and that's threshold whereby we start to sick, that's the whole spectrum, and how we target that optimum level, not just merely not being sick. And it starts with each of us, personally, our family. So yeah, treating health like we do with our wealth, basically.
Health is wealth. Thank you very much, Quitterie. It's a strong call to action. I'm sure it's going to be heard. Your vision of hybrid healthcare, consumer-centric approach, and the urgent need actually to focus on Healthspan rather than just lifespan really changes how we think about the future of wellness. So for the listeners who want to learn more about these transformative approaches to healthcare innovation, where can they connect with you and follow your work?
Easiest is to follow on and to connect on LinkedIn. And as you say, I'm passionate about those topics, both actually professionally and personally. And always happy to share and contribute where I can. So you can reach out on LinkedIn. I'll be happy to help.
Great. And we'll put the link to your LinkedIn actually in the description of this podcast. So thank you very much again, Quitterie. And to all our listeners, if today's conversation sparked new ideas about how technology can truly serve human health and well-being, I'd love to hear from you. So connect with us on LinkedIn and don't forget to subscribe wherever you get your podcast. In the meantime, stay curious, stay ahead, and see you soon on Next to hear what's next in tech and leadership. Bye-bye.